The final point I would make to Governor Romney, you just don't have credibility, Mitt, when it comes to repealing Obamacare. Your plan was the basis for Obamacare. Your consultants helped Obama craft Obamacare, and to say that you were going to repeal it, you have no track record on that we can trust you that you're going to do that. The governor of Massachusetts just is coming forward saying we have to pick up the job left undone by Romney Care, which is doing something about cutting health care costs.
Now, I can't tell you this. It's absolutely right that there's a lot that needs to be done, and I didn't get the job done in Massachusetts, and getting the health care costs down in this country is something I think we got to do at the national level. I intend to do that.
And candidly, Mitt, your plan ultimately, philosophically, it's not Obamacare, and that's not a fair charge, but your plan essentially is one more big government, bureaucratic, high-cost system, which candidly could not have been done by any other state, because no other state had a Medicaid program as lavish as yours, and no other state got as much money from the federal government under the Bush administration for this experiment. So there's a lot of big government behind Romney Care, not as much as Obamacare, but a heck of a lot more than your campaign is admitting.
Governor Romney? 30 seconds.
Actually, we got the idea of an individual mandate from you.
That's not true. You got it from the Heritage Foundation.
Yeah, we got it from you and the Heritage. You got it from the Heritage Foundation and from you.
Wait a second. What you just said is not true. You did not get that from me. You got it from the Heritage Foundation.
And you've never supported.
I agree with them, but I'm just saying what you said to this audience just now plain wasn't true.
Let me ask, have you supported in the past an individual mandate?
I absolutely did with the Heritage Foundation against Hillary Care.
You did support an individual mandate?
Sure.
Oh, okay, that's what I'm saying. We got the idea from you and the Heritage Foundation.
Okay, a little broader.
Okay.
I did.
Number one.
He still has time. Sorry, he still has time.
Number two. Let me finish.
He still has time. Let him finish.
I get a little time here. Number two, we don't have a government insurance plan. What we do is rely on private insurers. And 93% of our people who are already insured, nothing changed. For the people who didn't have insurance, they get private insurance, not government insurance.
Congresswoman Buchan.
Anderson, I think it has to be stated that Obamacare is so flat out unpopular that even the Obama administration chose to reject part of Obamacare last Friday when they tried to throw out the Class Act, which is the long-term care function. The Secretary Sebelius, who's the head of Health and Human Services, reported that the government can't even afford that part and has to throw it out, and now the administration is arguing with itself. When even the Obama administration wants to repeal this bill, I think we're going to win this thing. We're going to repeal it, and I will.